Good morning, my professor. My name is Chidinma Onyekwe. Welcome to my presentation this morning. Let's talk about the future. On graduation, I hope to practice in the El Paso Behavioral Health Systems in Texas. I was privileged to encounter El Paso during my initial clinical posting, and I loved everything about that environment. Generally, El Paso is considered a safe place, probably one of the safest in the country. This may be attributed to the presence of several law enforcement agencies and an engaged vigilante community. El Paso Behavioral Health System is a big hospital that provides psychiatric and chemical dependency treatments for children, teens, adults, and senior adults. They have both inpatient and outpatient services. It is a safe environment, well lit, good security, and have a massive land space, so parking is not an issue. They are very organized, which was part of what attracted my attention. They have multiple gender-based restrooms with 24-hour housekeeping services. They have a 24-hour service cafeteria, and you can order food online or on site. There are multiple conference rooms attached to each wing of the building. The pediatric unit has a large playground for kids and richly equipped with all sorts of toys. It has multiple exam rooms and waiting area depending on which provider you are visiting. They have a large laboratory building with multiple storage and utility rooms. Each provider has his own office. In terms of taking calls, if it is a requirement, I'll be very flexible about it. If I had need for a vacation, I'll be sure to notify them on time. For example, my son will be getting married both traditionally and legally in December 2023. It is a big event for my family in Africa and I must be present. So I will make sure to notify them on time for adequate coverage. This means I will be keeping my PTOs to enable me take minimum of 3 weeks to 1 month vacation. If I need to supply my own coverage while I'm out, I will start early to look for one. This is often not a difficult situation where there is good working relationship with your co-workers. I will find out who makes the decision and I will comply. I'm very good at obeying such rules. From my understanding, 30 minutes is given to each patient, that is a previous patient, while 45 minutes is given to new patients. The hospital paid their staff as a W-2 employee with benefits, and that is what I desire. Following graduation, I will work for about 3 years for the El Paso Behavioral Health Services, at the end of which I hope to be more confident enough. I hope to be very confident enough to start my private practice. I plan to establish a private practice with my first 2 daughters. I'll speak with an attorney to determine which entity is right for my clinic. I will utilize all the available resources at my disposal. My preceptors, I was privileged to have very good preceptors that are dependable, that I could talk to. I will also talk to my instructor, Professor Ruth and Professor Bamista, who are always willing and available to help. My husband, who is a retired accountant, will also impute. My practice will cut across the lifespan since I'm interested in adults and geriatrics. My first daughter prefers kids, while my second daughter likes teens and treatment of those with substance abuse disorder. We will need an office. We will need an office building with 3 providers' office, a waiting room large enough to contain the receptionist with the patients that are waiting, 2 toilets, 1 for patients and 1 for staff, a receptionist, and a billing staff for a start. Along the line, if we need to employ more, we will do that. I hope to go for additional certification on billing probably EMR training. Though I will hire a staff that will do billing for me, I still need to be sure that he is doing it right. While working with my two daughters in this private practice, I hope to apply online to marketplace for private insurance, find quotes, compare plans, and get covered. For the retirement benefits, I hope to use the simple IRA, which is an easy way for small employers, including self-employed, to offer employees a retirement plan. It uses the rules of a traditional IRA, so it's tax deferred and has the same withdrawal requirements at retirement. For my 5-year plan from 2023 to 2027, the first 3 months of 2023, I'll be studying for my exams, and by April, I'll be ready to write my exams, after which I will do my licensure process and credentialing. By May, I think by May, the school will officially be celebrating the graduation for students. That's the big one. Then in June, from June to October, I will just be working, and that will be work/self-care. When I say self-care here, I mean like work for my normal 5 days in a week and go for my weekend outings or my daily gyms or my choir practice or daily Sunday worship, which are the things that make me happy. November is my birthday with my son. I normally take a weekend out during my birthday. By December, I should be, like I said earlier, I will be traveling to Africa with my entire family for my son's wedding. And that should last till early part of January when I come back to resume work. February will be my wedding anniversary. I normally take a weekend during the Valentine period with my husband. That's our wedding anniversary. Go spend some weekend together at any place of our choice. Come back to continue my work the whole of March and April. By May, it's my husband and my son's birthday, which we normally celebrate on a weekend. I plan to attend conferences twice in a year, and I've scheduled them for June and October. In between, it will just be work and self-care. By November, it will be my birthday again, and depending on if my son is available, we normally have a weekend celebration. Then by December, it's our family get together. Most families celebrate their weekend, their get together in Thanksgiving, which is November. But for my family, we defer it to December. That's when we all come together and celebrate. Then in 2025, January is still work and self-care. By February, it's my anniversary again, and like I said earlier, I take a weekend out with my husband on a Valentine weekend. Continue with my work and self-care. By May, it's my husband and my son's birthday, and in June I'll be ready for another conference. And then the big one again is in July 2025. If my mother is still alive, she will be celebrating her 90th birthday in Africa, and that is another big one because all of us will be in Nigeria for that celebration. I will come back to continue with work, and by September I'm due for my license renewal. You can see the first initial licensure was in April 2023. That's 29 months. Initial licensure, they normally let you go for 29 months, but subsequent licensure is 24 months, and that is why it is here in September 2027. After which I will go for a conference in October. It's my birthday again, and it's the family get together. In 2026, it's still the same schedule, and by April I'll be due for re-credentialing. Normally you do your initial credentialing and you have to redo it every 3 years. So by 2026 April, I'm due for re-credentialing. Then it's my husband's and my son's birthday again, another conference for me in June. Work and self-care continues until October when I go for another conference. Then me and my son's birthday again in November. The family get together comes up in December. And by 2027, it's still the same schedule up to June when I have my another conference. And by September, I'm due for a license renewal again, which is 2 years from the second renewal. My third renewal will be in 2027 September, and the schedule continues up to December again, which is my family get together. Thank you for listening. Thank you for listening.